Sound check, 1, 2, 3. Sound check. Hey, good evening, everybody. My name is Dr. Nathan Thompson with the Wellness Way Yorkville. Happy Monday, guys. I hope you had a great weekend. I hope you enjoyed your Monday. Today, I'm going to talk about an interesting topic: inflammation explained. Now, just so you know, this is a rehash of one that I have done before, but that's okay. And I'm going to explain to you why, because people are like, oh, what are you doing at an old topic? Well, if you went to church on Sunday, can you explain to me what the pastor talked about? So I'm going to show you again. And in fact, a lot of times I'll have to rehash some things just because of the same question get over and over. And we also have a lot of new followers and things like that. I'm going to explain to you inflammation from a different perspective. And the reason why I think you need to go over this sometimes more than once is because I'm going to talk to you about an idea, but I know the term inflammation is just thrown around so much. But a lot of people don't understand what it is, where it's coming from, and yes, why the body is doing some certain things. So let's go over inflammation from just a little bit different perspective. I'm going to help you to explain this to you, but I'm going to help you understand it hopefully a little bit better. So if you're watching right now, make sure that you say hello. Make sure you also let me know where you're watching from. I always love to see people from all different demographics, from different countries, from different parts of the United States. If you're watching, just please say hello. Let me know where you're watching from as well. So let's talk about inflammation explained. And I'm going to talk to you from a little bit different perspective, but I want this to make a lot of sense for you. And as soon as it makes sense, I want you to have a light bulb moment. And if you have a light bulb moment, then just go ahead and put a light bulb in the comments so that I know that, hey, this is starting to make a lot of sense. Now, this is not the inflammation talk. Our actual inflammation talk at our office, if you're from the Chicagoland area and you want to work with us directly, please make sure that you go and you register for the inflammation event. That's Tuesday, September 17th at 6 o'clock p.m. Yes, that's tomorrow. But anybody who is dealing with issues with weight loss resistance, cancer, problems with their hormones, infertility, the inability to be able to conceive, thyroid issues, chronic arthritis, type 2 diabetes, autoimmune diseases, hormone imbalances, in which you really can't balance your hormones because hormones are responders to other things. I talked about that last week. Um, but if you want to work with us directly and you might be suffering with some of those things, then make sure you get registered for our next inflammation event, which is going to be tomorrow. This is an in-person event, yes, at our office. And in fact, if people want to work with us, we're like, great, first visit is going to be the inflammation event. We're not trying to punish you, but what we're trying to do is help bridge the gap so that a lot of things that I'm going to recommend for you are going to make a lot of sense for you. And if you register for that, we even have a free, we have a special gift. Not a free gift, but a special gift for you at the very end. So make sure you get registered for it. Well, Dr. Nate, how do I register for it? Well, one of the things, if you follow us on Facebook, or if you're on Instagram, or if you're on YouTube or on Rumble, then all you got to do is just go to the top of our page of our profile, and you're going to see a link called Linktree. And if you click on that link, one of the first things that pop up is how to register for the inflammation event. So you'll see that right there. So this is why you want to, if you want to work with us and you're from the Chicagoland area, you want to work with us directly, that's your ticket in order to get in to start the process of looking at things differently, especially. Okay. Someone asked the question, well, why don't you work remotely? I'm like, well, because it's full. Okay. I only have so much time to work with people from different parts of the country to work remotely. It's full. And full disclosure is I just really like meeting with people on a personal basis, one-on-one, more than working with people over the phone. So full disclosure, I just don't enjoy it all that much. I would rather see you face to face, because I get to see a lot of things that you can't see, especially over the phone. And that's why I love technology. But there's just certain things that technology can't replace, especially. So get registered for that event. Now, if for some reason you're like, Doc, I can't make it to the next inflammation talk, well, check back in like a day or two. And the reason why I say that is because we'll be scheduling our next one for October. If you schedule the next one for October, hopefully you can make it to that one. I don't know the exact date on it, but it will be 3 weeks from tomorrow will be our next one. So you can check back and register for it. Registration is super easy. If you just click on that link right there, you can register yourself and a guest if you want to, and it'll take you about 30 seconds to be able to register for. The only thing that we ask is we put a lot of time and effort to make it a great experience for you. So if you're registered for it, please make sure that you are showing up. Okay. So inflammation, I'm going to give you, here's the big idea with inflammation, because I know a lot of people reach out to me. And the first question they want to ask is, Dr. Nate, I have inflammation. What supplement would you recommend for it? The big idea I want you to take away from today is you're not a teaspoon of turmeric away from ultimate health. Okay. And in fact, I know that sometimes people reach out to me because they're like, maybe you know a supplement that I haven't discovered yet that's not working. And I'm like, well, you're on 32 of them. So, you know, something's not working. You need to look at it from a different perspective. So this isn't like, hey, what supplement you need to be on to handle inflammation. No, this is getting down to the nitty gritty and to find the actual cause. I had a young individual who came in who was suffering with a lot of chronic inflammation, and we did his follow-up after 5 to 6 weeks. He's like, Doc, this is incredible because I feel better. I have more energy. I'm sleeping better. I have so much less bloating. I'm just feeling so much better. And I'm like, great. You know why you have more energy? You have less inflammation. So many people are suffering with low energy and fatigue and things like that. Inflammation can be the big time culprit. And in fact, I had a woman today who came in who's really been struggling with mycotoxicity. And I said, let me guess, low energy fatigue, you feel hazy, crazy, and lazy. And I remember her eyes just got so big and she's like, yes, that's exactly how I feel. And I'm like, well, you're going to feel that because your immune system is always being activated by certain things that you've been breathing in and trying to get rid of as well. But the big idea I want you to understand is you're not a teaspoon away of turmeric from having ultimate health. Your body is a lot more complex than that as well. But when we talk about inflammation, I'm talking about an idea that is accepted in the medical community and is also accepted in the alternative health. And I don't understand alternative health because I'm like, how can having a good lifestyle be alternative, you know, especially? So this is an idea that is well accepted no matter what health field that you're going into. Now, I remember a patient brought this to me, and this is the cover of a magazine from AARP. And sometimes I say I'm not that far away from actually being able to subscribe to it. So AARP Bulletin, this is from about 5 years ago. And on the cover, they said this: the secret to good health and a longer life. And then on the inside, they said the cure for everything is researchers have linked inflammation to nearly every critical disease of aging out there. And start to reduce it now, and you can clear your life for a healthy path of health, energy, vitality, wellness, and of a lot, and being free of a lot of chronic degenerative illnesses out there. So if you look at this and you look at inflammation, a lot of times people say, well, I don't understand why medicine in your field why you just can't get along. And I'm like, we actually agree on a lot. We agree that inflammation is a spark that leads to every chronic degenerative disease out there. The problem is that how we differ is the path that we take. Okay. So we all agree that inflammation is a big, big problem. Okay. And it's linked to nearly every single disease of aging, chronic degenerative illness that's out there. But you got to understand, where do we differ? We differ with the approach and how we're actually tackling it as well. And this reminds me of a young girl who came in not that long ago, who was diagnosed at 9 years of age of ulcerative colitis. And then I looked at, well, what did the doctors put her on? They put her on prednisone. They put her on omeprazole, which is an acid reflux medication. And I have talked about this. And guys, here's the thing. I don't have any problems with you guys needing to put out a fire, but where the problem is if you keep having a fire and keep having to douse it with water, then pretty soon you're living in a house that is decaying, crumbling, and rotting. And that's a lot of people as they get into their 50s, 60s, and 70s. But unfortunately, this is a lot of young people too, who are suffering with so many instances of autoimmunity and things like that. So this is where we differ right there, is being on this for a lifetime, okay? Being on prednisone and being on an acid reflux medication. I've talked extensively about this. The concerns being on this long-term is how this can actually affect fertility long-term, especially in a young girl. And then also being on acid reflux medication, because anytime that you go on an acid reflux medication long-term use is linked to dementia. Long-term use can also lead to bone loss, can lead to premature fractures, especially at a young age, especially in this girl being on a long time, and also lots and lots of infection because they're lowering stomach acid, which means that they're going to be lowering the body's ability to be able to sterilize food. And that means she's going to be carrying down the road a lot of infection within the gastrointestinal system and just causing more problems within the gastrointestinal system, especially. This is why when you look at this, and you look at someone at such a young age who's been diagnosed with such a severe illness, you want to look at them and you want to say, what is your doctor's plan moving forward? And you know what they say 99% of the time? Doctor, there is no plan. There's no plan moving forward other than just to be doing the same things forever. Okay. Here's what's so interesting about a young girl with ulcerative colitis. She had all of the warning signs for years before they finally were able to quote unquote diagnose her. Terrible bloating, terrible gastrointestinal upset for a long period of time. Was also a colicky baby, as well. And I even asked about the well baby visits. Okay. When people do ask me, and they're like, hey, off the record, what do you think the biggest cause of illness, chronic illness in young kids today is? And I'll say, well baby visits, if you know what I'm talking about when it comes to that. And of course, the history just aligned with all of those questions that I asked. But what are they trying to do? They understand that she's got inflammation, but the approach that we're going to take is so different than that, because this is just lifetime of immunosuppressants. And this is why they know that they know that inflammation is a problem, because what is prednisone? It's a massive anti-inflammatory. So basically it's just simulating a high stress response, and a high stress response in a person is very anti-inflammatory. But then they also have her on, medications. I don't know why this actually doesn't even make that much sense. They're probably following some kind of guidelines or some kind of protocol or something that someone comes with ulcerative colitis and things like that. Which leads me to this, because guys, there's a lot that we agree on, but we're going to disagree when it comes to the actual approach to inflammation. So I want to ask you guys this question. How do you get a baby to stop crying? How do you get a baby to stop crying? Okay. Well, there's two options that you can do. Number one, you can cut out their tongue, or you can figure out the reason why they are crying. And in fact, when you look at a lot of healthcare today, basically a person's so inflamed, their immune system is screaming, and it's not messing up, by the way. Their immune system is screaming. So a lot of what doctors do is they're just basically suppressing the immune system response, which would be no different than if a baby is crying. We're like, well, here's our answer. We're going to cut the tongue out of the baby. But the problem is it never got to the reason why the baby was crying in the first place. And that's just the approach that we do, is that a lot of medicine is just, number one, cut out the tongue. But number two, within the wellness way, we're saying, let's figure out the reason why that baby's crying, or let's figure out why you're actually getting so inflamed, which I'm going to talk about a little bit deeper here in just a second. So if you look at this, basically, if you look at what they wanted this young girl to be on for a long period of time, was basically just cutting out the tongue of a baby crying. It's just suppressing the immune system for a long period of time, but it doesn't get to the reason why the immune system is excuse me, behaving that way. Okay. Big difference between the two. Here's an interesting test that we did. This isn't all the testing that we did, but I said you need to get her foods tested and figure out why the body is responding to certain food proteins, especially. So we did both IgE and IgG food allergy tests. And just from the 8 that we looked at, she had 5 IgE food allergies to almonds, soybeans, corn, peanuts, and wheat. And then when you look at an IgG response, which, yes, it is an allergy response, doctors don't call it an allergy because they just don't understand that an allergy just doesn't have to be, some kind of anaphylactic shock. But you can see when we tested this, 36 different food allergies. And if you look at this right here, people say, does this young individual have a leaky gut? I would say, yep. Yep, there's a lot of barrier dysfunction that's taken place, which is why she's leaking so many food proteins. And guess what? Omeprazole, lowering stomach acid, is actually going to further this or make it worse because you actually don't absorb or you don't break down your foods or your proteins when you're on an acid reflux medication. We did stool testing and her stool showed a tremendously high amount of proteins that were actually in it. So you can see 36 different food allergies. Now, let me ask you a question. Does prednisone or being on omeprazole, is that going to fix the reason why this person had so many food allergies? Now you can see the immune system is just going haywire, responding to all these different kind of proteins. Then you got to figure out why is that happening, especially. So let's go to the Cleveland Clinic and let's see what the Cleveland Clinic says about inflammation. Okay. Now, some of it I agree with, some of it I'm not going to agree with what they say. So Cleveland Clinic says this: what is inflammation? Here's what they say. When your body encounters an offending agent like a virus, bacteria, or a toxic chemical like a toxin, okay, or suffers an injury that's going to produce tissue damage, it activates your immune system, okay? Now, I don't think that it's actually activating the immune system because you got immune cells that are going around patrolling the area all the time, okay? These cells begin an inflammatory response to trap bacteria and other offending agents or start healing injured tissue. The result of what happens when it encounters an offending agent like a bacteria, like a virus, or a toxin, I would also say a food protein as well, can be pain, swelling, bruising, or redness. And in fact, a lot of times they're not even getting to the big reason as far as some of the symptoms are, which is why a lot of people just can't identify it as well. Now, let me step aside. I want to say this, okay? So if you looked at like COV, et cetera, I'm talking about, and now, you see the push for monkeypox or mpox. I don't know if this will get me in trouble for saying this, but they're always saying the symptoms of this are this. And you think like, well, I need to memorize the symptoms of COV, et cetera. I need to memorize the symptoms of COVID or, I said it, or of mpox. And you're going to notice, well, a lot of these are actually presenting the same way. And here's what they say. The most common mpox symptom is a rash that looks like pimples or blisters. The rash can be on any part of your body, including around the genitals or buttocks. Other symptoms can include, I wonder how you got it right. But you can also have things like body aches, swollen lymph nodes, fever, chills, respiratory symptoms like cough or congestion, okay? And you're going to notice that anytime that you get any kind of lung infection or anything like that, it all presents with the same symptoms of fever. That's a sign of an inflammatory response. Chills goes right along with fever, signs of an inflammatory response. Cough and congestion, that's signs of inflammation. It means that the immune system is working, that the immune system is trying to clear those out. Yet we are taught that the body is stupid and that we have to suppress that as much as possible. And that's why you don't have to memorize, a list of certain different illnesses. You're going to notice that, hey, if I get something in my lungs, yeah, I'm probably going to have a fever. I'm probably going to have a cough. I'm going to have congestion. Those are all symptoms my body is trying to clear it out, especially. So moving on to the Cleveland Clinic and what they say between acute and chronic inflammation, okay? Acute inflammation is the response to sudden body damage, such as cutting your finger. To heal the cut, your body sends inflammatory cells to the injury. These cells start the healing process. With chronic inflammation, your body continues sending inflammatory cells even when there is no outside danger. That's where I start to disagree with it, because the body is not messing up, okay? For example, in rheumatoid arthritis, inflammatory cells and substances attack joint tissues, leading to an inflammation that comes and goes. Gee, I wonder why it comes and goes. There's a reason why that happens, and can cause severe damage to joints with pain and deformities. Yes, it absolutely can. But here's the thing: when they talk about chronic inflammation or any kind of autoimmunity, is that they say that the immune system is attacking healthy tissues. That's not the job of the immune system. It's the job of the immune system is not to randomly attack healthy tissues. The body just doesn't work that way. Okay. So, what are the symptoms of acute and chronic inflammation? Acute inflammation may cause flushed skin at the site of injury, pain or tenderness, swelling, heat. So, redness, swelling, heat, and pain. Those are all cardinal signs of acute inflammation. Chronic inflammation symptoms may be harder to spot than acute inflammation symptoms. Signs of chronic inflammation can include abdominal pain. Yes, like bloating, okay? Chest pain, fatigue. Guys, this is absolutely huge. When someone is chronically inflamed, fatigue is a huge issue. Just ask someone who's got mold and they'll say, I can hardly get out of bed. They can have chronic fever, joint pain or stiffness, mouth sores, even skin rash. This is especially true if you're talking about mold and the chronic inflammation that it can cause as well. Okay. All right. So Cleveland Clinic talking about acute and chronic inflammation. What conditions are associated with chronic inflammation? This just goes back to what we talked about at the AARP. Alzheimer's disease is a chronic condition. Yes. Asthma. Yep. Chronic condition. I was an asthmatic for 20 years. I haven't taken an inhaler now in 20 years, even though they said I would have it for the rest of my life. Cancer, heart disease, rheumatoid arthritis or ankylosing spondylitis, type 2 diabetes. So they're talking about chronic conditions that are going on that are just getting driven by inflammation, okay? Cleveland Clinic, finally, they're going to say, what are some of the most common causes of inflammation, okay? They're going to say autoimmune disorders, exposure to toxins, and untreated acute inflammation. The common causes of inflammation are not autoimmune conditions, okay? You have to have an offending agent that's creating the inflammation. It's just that how they describe autoimmunity is they will say where it's happening. So if it's happening in the joints, they call it rheumatoid arthritis. If it's happening in the vascular system, they call it lupus. If it's happening in connective tissues, they call it scleroderma, or something like that. So, but your body isn't going haywire for no reason. That's not how the body is actually built. Some lifestyle factors can contribute to chronic inflammation, like drinking a lot of alcohol. I agree with that, especially with a lot of people having food allergies to brewer's yeast, especially. Having a high body mass index. I agree with that. And the reason why is having high amounts of fat stored on the body will in and of itself cause your inflammatory levels to increase as well. Exercise at your maximum intensity to frequency, or you don't exercise enough. And there's some truth to that as well, because over-exercise can make you chronically inflamed. Or if you don't move enough, you tend to feel stiff and things like that. Chronic stress, absolutely. And smoke, yep, absolutely too. And the reason why, the more that you smoke, the more that you're injuring the lungs, and they're going to have to always heal and repair, which is why you can get a lot of lung inflammation as a result, okay? Biggest thing I'm going to tell you when it comes to inflammation is it's an immune system response. And why is it responding? It's responding to tissue injury or foreign proteins, sometimes even both, okay? And this is why everyone thinks, oh, if my knee hurts, then I must have done something to injure it, and then I must get it adjusted in order to feel better. That's not the right thinking, guys. I will tell you that. So let's move on to tissue injury, okay? This is a scab on a knee. And this is one of the first things I talk about at the inflammation event is I say, if you have a scab on your knee, if you fall down and you break the skin, you injure the skin, you're going to have an acute inflammatory response. There's nothing that you can do about it. It's the body's way to heal and repair. It's going to get red. It's going to get swollen. It's going to get painful. And it's probably going to be hot to the touch. That's exactly what's supposed to happen when it comes to inflammation. But we've been taught that you need to suppress it. And this is why I've talked about this a lot. I'm like, if I sprain my ankle, what are you going to do? I'm like, I'm going to start moving it as quickly as possible, and I'm not going to ice it. And I've had some injuries, working out. And guess what? I never did. I never iced it. The reason why is either the body's response is wrong or the body's response is actually right. And I know what you're going to say. You're going to come up with some kind of brain injury or something like that. If you need to do something in order to save the life, that's like saying, if the body can heal, shoot yourself in the head and now it can't anymore. That's because there's too much trauma that the body can't overcome in such a short amount of time. But we've been taught that acute inflammation is bad. So if you fall down and you skin your knee, that's not a disease, that's an injury. And that's why if you start looking at all the problems that you have, if you start looking at it as an injury rather than calling it some kind of complex disease in Latin and things like that, with the scary itis on the end of it, and then you use that as your badge of honor to explain why you don't feel good, why everyone should feel sorry for you, you need to start looking at it differently. So if I had a tissue injury, and let's say that 3 months later, that wasn't healing. If you came to me with a chronic scab on your knee that wasn't healing, you know what my first question I'm going to ask is, what are you doing to injure it? And if you said, well, every day I go on a walk, I hit a buckle on the sidewalk and I fall down and I skin my knee every single time, you know what I'm going to say? Maybe you should take a different direction. But we're not going to biopsy, come back, do $19,000 of testing, and then come back and say, yep, confirmed, you have a chronic case of chronic genu scabitis or knee scabitis, okay? This is an injury, and if you start looking at what's ailing you, if you looked at it as an injury versus an illness, it'll totally change your perspective as far as what you're dealing with, especially. So here's the different perspective that I want to offer to you. Does your body make mistakes? Because we've been taught that our body does nothing but make mistakes and mess up. And that's why, rather than ask the question, why is this? What am I doing in order to cause the inflammation? Am I doing something to cause any kind of tissue injury or the introduction of foreign proteins inside of my body that's just making my immune system do exactly what it's supposed to do? What if your body doesn't make mistakes? I'll even ask this at the inflammation talk, and I will ask them, is high blood pressure bad or good? Immediately they say, it's terrible, it's bad. And I'm like, it might be if it's there chronically, you never get to the reason why it's happening. But let's say a bear decided to chase you. It was really hungry, and your job was to get away from the bear, or you're going to be the bear's lunch. Does your blood pressure need to go up? Yep. Your stress hormone is going to go up? Yep. Is your digestive system going to shut down? Yep. Great. That's an appropriate response. Are you going to mobilize a bunch of blood sugars? Yep. Blood sugars are probably going to be really high. And all of those things are the necessary response of helping your body avoid conflict or to avoid a stressor, especially. So what if your body didn't make a mistake? What if everything was happening was just it trying to adapt as much as possible to the stressors that you are not addressing in order for it to get complete resolution, okay? So if you look at inflammation, here's the different approaches. Most of what medicine is actually doing is either to handle inflammation or to treat the effects of the inflammation, and that is done with drugs. Now, a lot of times people are like, I don't like that approach. And if you're watching, you probably say, I don't like that approach too. But then we go into what we would call natural medicine, the Dr. Oz effect, or even the Dr. Mercola effect as well. And we want to treat the effects with natural supplements. So like, well, what about curcumin, boswellia, some ginger, some fish oils in order to lower the inflammation? But if you look in our approach, you look at the Wellness Way approach, we're saying this, hey, listen, the body's not making a mistake. You have to find the source of the inflammation, which is either tissue injury or foreign proteins. And how you figure that out is by doing the right types of testing, especially. So let's talk about where that inflammation can be coming from. The first thing I want to talk about is tissue injury, okay? So where can you get inflammation from? Well, if you keep damaging and injuring your tissues, they're going to get inflamed. How do they get injured? Well, through trauma, okay? So you get in a car accident, you're going to have trauma. You may hurt your back. You're going to get an inflammatory response. Yes, it's painful. There's no doubt about it, but there's a purpose behind all of that. So trauma. How about poor structure, meaning you're not lined up with gravity. The head's going forward, loss of curves, all of that. Poor structure will lead to chronic inflammation. Improper movement can cause tissue injury. This is absolutely huge. This is why we did the You Don't Know Squat Challenge, because a lot of people, when they squat, they basically look like a baby giraffe. All right. Sorry, guys. You just need to be working on some of these things. But if you have improper movement and you're doing that repeatedly in exercise, improper movement is just going to cause tissue injury. You may be over exercising, which I've seen people do as well. Over exercise followed with poor recovery. And guys, I've been guilty of this too, is overexercise and poor recovery. And when we talk about recovery, I'm talking primarily about sleep, which the Wellness Way is going to be doing a sleep challenge coming up in October. It's going to be absolutely fantastic. All you got to do is just join the Wellness Way challenge group. And then they'll talk about developing good sleep habits so that your body, because your body heals while you're sleeping. Your body recovers and repairs while you're sleeping. If you skimp on sleep, then you are skimping on repair and recovery, which is why it can cause so many other issues too. Okay. Or you may have tissue injury from injured cells. How do the cells get injured? Well, it doesn't have to be poor structure or improper movement. It might be a viral infection. It might be type 2 diabetes. Guys, people with type 2 diabetes have so much chronic inflammation just because high blood sugars cause glycation. And that just damages the soft tissues, especially. That's why people with high blood sugar, and they're not doing anything to address it, which is why they have so many joint issues, endothelial dysfunction with high blood pressure, high cholesterol, things like that. And then even carrying a high amount of body fat can also cause a lot of inflammation as well, because fat cells in and of themselves are inflammatory. They're just inflammatory, which is why the more body fat you carry, the more inflamed you're going to feel. Okay. So the first one is where is it coming from? Well, tissue injury. The second thing that I'm going to talk about that nobody really deals with at all is foreign proteins. And that's what the immune system is designed to respond to, is foreign proteins, whether that's a bacteria, whether that's a virus, or whether that's something that bypasses the barriers that the immune system sees and says, you don't belong here, we're under attack, and I'm going to handle you, okay? So where are you getting your foreign proteins, or your foreign bodies, I should also say, because it's not just bacteria and viruses. But yes, you can get them from bacteria. What are we talking about from the bacteria? Well, this can be having any kind of lung exposure that can create an inflammatory response, but also bacteria that is there within the colon that doesn't belong there, especially if you start getting overgrowth of certain bacteria. And guys, this is why it's so important that you are sterilizing your food with proper stomach acid, because that actually is what helps to drive a healthy microbiome. Because you can have overgrowth of certain bacteria. No, you didn't catch it. It's just the environment favors it. And that's a constant immune system trigger as well. Okay. Same thing with viruses. But if you talk about toxins as well, toxins will elicit an immune system response. And it's also things like mycotoxins, okay, like mycotoxins that are coming from water damaged mold, biotoxins like Lyme disease. And yes, even things that you are putting in your body, ladies, even implants. And I just did a reel about implants because people ask me all the time, what are your thoughts, on implants? I'm like, you're putting a sliver in your body and you're expecting the immune system not to respond to it. And then also what's really important too is food proteins. Food proteins, guys, this is what's so important, is that the immune system will respond to undigested food proteins, but it doesn't respond to amino acids. And that's why proper food breakdown is so important. If you start being highly stressed, then that's a good recipe start, first and foremost, of having a leaky gut and having a lot of barrier dysfunction taking place, especially. Okay. Now, how do you find it? How do you find inflammation? Well, here's the first thing that I'm going to tell you is long-term inflammation leads to calcification. Let me say that again. Long-term inflammation leads to calcification. And you can see it on your spine. So you'll see it on the spine in through here. And that just means these aren't lining up with gravity. There might be blood sugar issues too that are going on. And that just leads to calcification of the spine. If you want to calcify your spine really quickly, stop moving it, okay? Or have segments that aren't moving the way that they're supposed to. You can also see it within the arteries as well, and that's due to long-term inflammation. You start getting, think of your barriers. If you start having endothelial dysfunction within the vascular system, and that causes a lot of uptake of cholesterol into that area, that creates an inflammatory response that leads to calcification or atherosclerosis, okay? You can even see it within the thyroid too, which is amazing because, if people are like, oh, I've had thyroid issues for 25 years, and they just thought it was just a thyroid issue, but it was actually an immune system issue that was leading to a lot of chronic inflammation in the thyroid, you can see thyroid calcification as well. And that's why even looking at an x-ray can help you out to see what areas are actually starting to calcify because of long-term inflammation. How else do you find it? Well, look at your barriers. Now, this is, guys, is so important because I even mentioned this at the inflammation talk. Everybody gets the answer right. But where does a lot of your immune system sit? And everyone says it sits in the gut. And I'm like, correct. Why? And they're like, I have no idea. That's just what my influencer actually said. But I want you to think, when you think of the body under attack, the body trying to protect itself from foreign invaders, your immune system puts most of the immune cells where it comes into contact with the external environment. So that's underneath the skin, gastrointestinal system, lungs, and things like that, because it wants to fight the battle outside along the barriers, and not once it's just running just chaos inside the body. You wouldn't want to fight a war inside the castle. You want to fight the war at the castle wall, and that's what the body is actually trying to do. That's where it puts its immune cells. Most of your immune cells aren't sitting in your blood. They're sitting around the barriers within your lymph tissue and things like that. So how do you find it? Look at your barriers. And this is actually a great gastrointestinal barrier test. This is someone who had terrible bloating, Lyme disease, extreme fatigue, and things like that. 31 different food allergies, a lot of dysbiosis, and a lot of inflammation is taking place within the gastrointestinal system. That's why food and stool is basically looking at the gastrointestinal barrier, which is where, once that starts to go, this is where people start to have a lot of problems with chronic inflammation and their immune system and things like that. So you find it by looking at the barriers. How else do you find it? Can you see it in the blood? Yes, you can, but not everything. That's why you need to be running the right types of tests. And some of the things that test for chronic inflammation are high sensitivity C-reactive protein. And you can actually see this person very, very inflamed. Guys, this is why when you look at, this is why they can't figure this out, but when someone has rheumatoid arthritis, even in the absence of high cholesterol, they're much more likely to have heart disease, okay? And this is why inflammation is systemic to everything inside the body, including the vascular system. And it's not just cholesterol only, it's inflammation too. So high sensitivity C-reactive protein, homocysteine, which I know that aren't getting measured very often. What's hardly ever getting measured is S-adenosyl homocysteine, which actually will start to elevate before homocysteine will start to elevate. But you can look at this in an immune panel. You can also do a viral panel, which isn't run all that much. And the reason why is because if you are fighting a chronic infection, no, you didn't catch the virus. Most of these viral issues, they start popping up once the stressors are so high, and they just start to reactivate these viruses because the immune system under high stress can't keep up. And now you just see, things like Epstein-Barr, chronic fatigue syndrome, they just start to pop up their head. But you can run a viral panel in order to see and look for the presence of certain antibodies. And this might be Epstein-Barr virus. This might be cytomegalovirus. I mean, there's a lot of different viral issues that can take place as well. But think of this, even with, I have chronic fatigue syndrome. Well, why are you fatigued? Well, because your body is trying to handle something, is trying to fight something. And I've never seen someone trying to fight something that has an abundant amount of energy. I've never seen it. So this is why when people say, oh, I have COV, et cetera, why am I so fatigued? Because your body is trying to handle the virus. Your job isn't to go out and run a 5K. Your job is trying to rest, recover, and start to repair. So you can measure this by looking at some things within the blood. Can you also see some of the things that are causing inflammation within the urine? The answer is yes, 100%. So this is a mycotoxin test with someone who just couldn't figure out why they didn't feel right, didn't feel good, a lot of skin issues, a lot of rashes, things like that, and a lot of anxiety. And the woman I was actually talking to today had just a house that was riddled with mold. And I have to go back and look at her labs, as well. But she says, I have so much anxiety. I have so much fatigue. I just feel absolutely lousy, like all the time. And people with mycotoxicity will typically feel that way. And I don't want to become the mold doctor. That's why I don't talk a lot, but we deal with it a lot as well. But mycotoxins are basically an immune system. The immune system's just going after it all the time. And that's why you have to stop getting exposed to it, number one. And then number two, you have to safely get it out of the body, which is why things like binders, and a lot of antioxidant support, especially from the liver, because that's how the body is actually metabolizing it. So, what causes inflammation? This is one of the biggest things that I can tell you, um, because I talk a lot about stress at the inflammation event, and it's absolutely true. And guys, this is the whole chiropractic principle. This is the whole chiropractic principle of saying this: the body's designed to be healthy, the body is designed to adapt and be well. And the only time that it can't is when there's too many things that are bringing the body down. That might be mental stress, that might be chemical stress, that might be too many physical stressors. And that's why you really need to look at all three, and you need to be handling all three. Because if you decide I'm just going to handle one and you're missing two, there's not a lot of people that can sit on a one-legged stool. Okay. You might be able to sit on a two-legged stool, but for that stool to be stable, you need to be looking at all three of those different things. Okay. And this is why I will say is that you don't have to manipulate everything. What you need to do is be really good at finding the stressors and know how to remove those stressors, so that once you remove enough, the body can start to heal and start to adapt the way that it's supposed to. So what causes chronic inflammation? Now, I want you to pay very special attention to this: lack of movement. Okay. Oh, well, I get up and I exercise every single day. I'm not talking about just the fact you get up and exercise. I'm talking about proper movement, even in the spine, because if you have segments that aren't moving, they're stuck, there's scar tissue in through that area, they're not going to move, and they're going to start to become inflamed. They can calcify. Okay. So lack of movement is absolutely critical. Spinal or extremity trauma. This is true too. And this is why I'll ask people, if you had any car accidents in the past, and people say 20 years ago, but it was good. The pain went away. That doesn't mean the problem went away. That just means that the inflammatory process went away. Remember, you don't feel a lot of chronic inflammation. If you want to be chronically inflamed, be stressed out and have low stomach acid. So low stomach acid is a result of high amount of stress, high amount of worry, especially lack of sleep, because you're just not repairing, you're not recovering. How about too much sugar? Okay. If your blood sugars are staying elevated, A1C, you should be measuring that. If that's staying elevated, then one of the things that it does is it just damages tissue. It damages the soft tissues, the red blood cells, and things like that. Just think about it. They measure glycated A1C, which is a soft tissue. Soft tissue, it's in your blood, which means if it's happening in the blood, it's also happening within your joint capsules and things like that, and also within your vascular system too. Carrying too much fat tissue can be an issue too. That will cause a lot of chronic inflammation. Having a fatty liver, these people that have a fatty liver are some of the most inflamed people as well. Same thing with mold toxicity or having mycotoxicity. Guys, the best way to measure it is actually to get a urinalysis to see what kind of mold you're actually dealing with. And how about nutrient deficiency? Yes, it can be, for example, not enough vitamin D, things like that. Yes, that can be. But the problem is that most people are looking at that first, and they're just thinking, what kind of nutrients do I need to dump inside my body? But you can go ahead, you can dump a bunch of B12 in, but if you have a lack of stomach acid, you're not going to absorb it. And that's why I can't stress enough that you need to test and you need to stop guessing. You need to test and you need to stop guessing as well. So inflammation, explained. So hopefully you understand that inflammation is an immune response, and it's an immune response to tissue injury, foreign proteins. You got to figure out, where is that actually coming from? Final thought that I want to leave with you is this: we have more specialists than ever before, and we have fewer and fewer people who are able to connect the dots. Isn't that true? And I always tell people, if you want to be upset in healthcare, because everybody's talking about you need more access to healthcare, and I'm like, you mean you need more access to a system that isn't connecting the dots? I don't want more access to that. I don't care, how much medication they want to dump down you, how much they want to be testing you the wrong way. I don't care how much they're doing that. You don't need more access to that. You need more access to things that are actually going to make you healthy. We have more specialists than ever before, and fewer who are able to connect the dots. And that's why I will always say, as a specialist, is someone who knows more and more about less and less, until finally they become experts in nothing. If you want to be upset with healthcare, get chronically ill, and you will see there will be no answers for you at that point. So you need to be able to connect the dots, especially. And guys, if what I just described is you and you're from the Chicagoland area, then here's what I want you to do. Get registered for our next inflammation event, which is September 17th. If you can't make it, then go ahead and come back to this link in a couple of days and you will see our next one, which will be in October, and get registered for that and start looking at things from a different perspective. Because at that inflammation event, yes, you'll have an opportunity to be able to schedule an appointment with me. But that will help me to look at your labs, be able to look at some things and direct you as far as where I want you to head when it comes to that. So if you are dealing with chronic inflammation, it's time to get it under control. This is an in-person event. So if you're watching from Great Britain, I'm sorry, but it's an in-person event. This is why I say from Chicagoland area, please get registered for this in-person event. All you have to do is just go to my link tree and go to this top link, click on that. It'll take you 60 seconds to be able to register for that. We'll get the notification. The only thing that I ask is if you register for it, please show up, okay? And please show up on time. Don't be late to that appointment too, because we start right at 6 o'clock as well. And if you come in late, everyone's gonna be looking at you like, oh man. So make sure that you register for it and make sure also that you show up. It's a great event. It's going to be worth your time. I can promise you that. So inflammation explained. So guys, if this helped you to see inflammation in a little bit different perspective, go ahead and just give me a thumbs up and go ahead and let me know that you're seeing it a little bit differently as well. Make sure to get registered for that inflammation event. Make sure if you don't already do this, please share this video. And also make sure that you follow us. If you follow us on those channels of Facebook, whether it's at The Wellness Way Yorkville or at Dr. Nathan Thompson, also on YouTube and Rumble, please give us a follow. I sincerely appreciate that. We'll always be giving out great content. And I think next week, one of the things I want to talk about coming up with the sleep challenge is I may talk a little bit more about sleep and the why behind it, the purpose behind sleep. It's not you just trying to be lazy. The body needs sleep in order to recover and to be able to repair. But a lot of people skimp on it and they don't have good sleep habits and they don't know the importance of sleep. So the biggest thing that I would tell you is start to develop the right habits and get plugged in so that you can start recovering and repairing by having proper sleep, things like that. So guys, thank you so much for watching. I hope you have a great rest of your week. If already, I may see some of you at the inflammation talk tomorrow night. So guys, be well, be blessed. As I always say, remember who you are. Thank you so much for watching. Please make sure you share this video and we'll see you guys very, very soon. Be